How can you transition from clinical nursing to corporate nursing? I get asked this question all the time. Hey there, my future corporate nurses. If you're considering transitioning from a clinical to a corporate nursing role, but essentially don't know where to start as it feels so overwhelming when looking for a new role, then I hope this video will shed some light for you today. I'll be sharing with you why your clinical skills are important and applicable during the transition, as well as some career tips based on my own experience to help you navigate when moving across. Now, if you haven't done so already, please subscribe to my channel so I can bring you more content in the world of corporate healthcare. And I'm actually intrigued to know where you are on your nursing journey, so please comment down below. If you don't know what corporate nursing is, then I do explain it in a little more depth in one of my videos, so please check it out if you haven't. Essentially, it's a non-clinical role, and I've been a corporate nurse for the last 7 years. Now, ideally as a registered healthcare professional, you'll have 2 to 3 years clinical experience before transitioning into a corporate nursing role. So ideally, if you're in the UK, this is from a band 6 role upwards. I'm not setting anyone up to fail, so don't rush into corporate because it's a beast and you have to be mentally prepared. And having your clinical experience builds on your professional credibility. You really do utilize your clinical skills in the non-clinical side of healthcare. Now, I'll only briefly outline how the clinical and non-clinical link, as I could talk about it a lot, but let me give you an example. Now, this is a made up scenario for the content of this video. Let's say you're working on the ward and you have an 85-year-old patient that had an unwitnessed fall and was found on the floor whilst doing hourly rounds. What do? Your priority is to take care of the patient and make sure that they are stable and seen by the medical team. What is equally important and part of good governance and the non-clinical side of healthcare is ensuring that an incident report is logged about the unwitnessed fall. And this should be logged within your shift. And this is where I come in. Bing! Because in my role, I would review the incidences and the harm scored and assign an investigator. That may be a ward manager or a falls lead. Now, I won't go into too much detail on the step-by-step process on how to investigate an incident, but if you want me to, comment down below and I'll be sure to create a video soon. Now, me having the clinical insight, I would automatically review the investigation report that assigned to either the falls lead, as I mentioned, or the ward manager, and I'll review and ask some questions. So one, to ensure that the factual information has been obtained as to what happened. Was a fall risk performed? Is the patient deemed as high risk? What was the level of injury? Were they on a falls care plan? Were room checks performed? Was a patient call bell in reach? All these things. Now, you probably do these things automatically within the wards when you're assessing patients, but it's so important when you are reviewing incident reports to actually make sure that all the safeguards were in place to prevent the fall. That's why I say having a good grounding of your clinical skills and expertise really does help you within the non-clinical side of healthcare, because you've been on the wards and in the department, so you know how to apply that knowledge across into a role within corporate, especially when you're reviewing incidences and reports. Now that I've explained a little bit about why your clinical skills are important, I'm going to go into some tips to help you within the transition. Tip number 1, research key areas you are interested in. Conducting thorough research is essential because there's so many opportunities in areas such as strategy, operations, workforce management, governance that I just talked about. I would really suggest that you do take some time to explore which are the areas you are interested in and identify which aligns best with your interests and skills. This will help you narrow down your focus and pave the way for a successful transition. I did a master's in healthcare management and strategic leadership. This was my first insight into healthcare being a business and all the different areas, as I mentioned, strategy. I looked into commissioning and consultancy. I literally studied almost 10 years post-qualifying, and that was when I came back from Saudi Arabia. If you don't know, I did work in Saudi Arabia as well, and I saw nurses in non-clinical roles, and they seem to have some sort of postgraduate study, whether it be a master's or a PhD. Now, PhD is not for me, but if it is for you, go for it. My classmates were international, so I was exposed to a lot of roles and had industry insights that they had that I tapped into. And I actually met a fantastic individual on the course who was so passionate about clinical governance that it made me want to go into governance, because when I saw her, I saw me. Then I just researched within governance, what roles are available, what's the career paths, and ever since then, I've been in it. Tip number 2, do a skills audit on a job description for a corporate nurse role. Assess your current skills and compare them to the requirements of your desired job. Obtain a job description for the role you're interested in and conduct a skills audit. For example, if your dream job is to be a director of strategy or patient safety manager, identify your strengths as well as the areas for improvement and create a plan to bridge the gap between where you are now and where you want to be. A lot of roles now are looking for masters or significant years of experience that will offset a master's, so you may need to update yourself with courses to demonstrate that you are potentially a desirable candidate. I remember reading a study once that was conducted, and it reported something like men apply for a job or a promotion when they only meet like 60% of the requested qualifications, but women apply only if they meet 100% of them. Listen. With nursing being a predominantly female profession, you need to get into these roles as well. Listen, for me that statistic has always stuck, which is why I always go for roles when I meet half the requirements, because there's always going to be work to be done. Another thing, that if you can invest in yourself, then do it. I self-funded my master's, but I was also fresh from Saudi Arabia, so I recently completed a diploma, and again I invested in it. And I can honestly feel that studying just does not stop, but it has helped me get into the positions that I am in now. And it's also choosing the right studies that will help and propel you into the career path that you want to go to. Tip 3, optimize your LinkedIn profile. In today's digital age, having a strong online presence is crucial. One platform you cannot overlook is LinkedIn. Create or revamp your LinkedIn profile to showcase your professional journey. Humbly brag. Yes. Put down your accomplishments and what you've achieved within your career. There are headhunters out there. Show companies what they are missing if they don't employ you. Often corporate nurse roles aren't advertised as corporate nursing jobs. You have to read the job description to really understand what the role entails. I spent time crafting a compelling LinkedIn summary, highlighting my achievements, as well as connecting with relevant professionals within corporate healthcare. This not only expanded my network, but also opened doors to new opportunities and valuable connections. Because my role is evolving, I always ensure I update my professional profile. Plus, you can easily apply to roles and talk directly with recruiters. You can literally apply using your LinkedIn profile. Now that I've shared with you why your clinical skills are, it's so important, and 3 career tips to help you transition from the clinical side of nursing into corporate, I'm really interested to hear your next move. Now remember to research the key areas, conduct your skills audit, and optimize your LinkedIn profile to increase your chances of landing a role within corporate. Now, these aren't the only tips. There are so much more, but these are some of the tips that I have used. I will be sharing a lot more in more videos to come. If you do have any questions or need any further advice, feel free to drop me a comment below. Don't forget to like and subscribe, and I'll see you in my next video. Bye.